cardiac surgeon by training, and I specialize in what's called structural heart disease, so abnormalities of the valves and the walls of the heart in both congenital and adult disorders. I both operate on folks with normal open surgery, but also do minimally invasive surgery, as well as repairing and replacing valves with catheters. We're very excited about our clinical research program here at Los Robles Regional Medical Center and focusing on cardiovascular medicine. We have over 20 trials right now that allow us to provide state-of-the-art technology and therapies to our patients in the community as a part of national trials. We've been very successful in enrolling and taking care of patients with a number of various disorders, including congestive heart failure, mitral valve disease, aortic valve disease, tricuspid valve disease, and also a number of problems with the conduction system of the heart. You might ask, why would I want to be involved in a clinical trial? Well, clinical trials are very important for us as a community and also as a nation and as a planet, really, to understand how we can better care for different medical problems in cardiovascular disease. However, in most of our trials, we're offering something that otherwise would not be available to patients. For example, for congestive heart failure, there's limited therapies after medications have been tried and failed, and heart transplant isn't available certainly for everyone. In fact, there's only about 3,000 heart transplants done in the whole country and over 5 million cases of congestive heart failure. We have some new therapies now that are being investigated and seem, in the early experience, to be quite successful in managing congestive heart failure. In addition, treatment of many complicated diseases of the valves of the heart have historically required open heart surgery. Many of these can be treated with procedures through our blood vessels in our leg, and it can be done successfully. The experience we've had here at the medical center has been really exciting with these therapies. Less invasive, most people go home the next day, and we're involved in many trials to look at ways to avoid open heart surgery, and these are ongoing and will be ongoing for many years and are now available here in our community. Many of you may have heard the news that we are now starting training programs for physicians here at the medical center. That's called graduate medical education, otherwise known as residencies and internships. We're starting in general medicine initially, as well as emergency medicine, and then eventually surgery, anesthesia, and OBGYN. It's very exciting because these young, excited new minds come to campus and they stimulate us as doctors, ask us a lot of good questions. It really adds to the capacity and capability of the hospital to provide the best of care. It's been very exciting the past few years here at the medical center. We've expanded our cardiovascular capacity and capabilities enormously. We've recruited new physicians to the medical center, and on top of the clinical trials, we are providing state-of-the-art, world-class care in cardiovascular medicine. It's really a pleasure to work here. Our staff is fantastic. The hospital facilities are very comfortable. I've always said this is a place you come to be healed. It's quiet, it's calm, it's relaxing, and the staff is absolutely world-class.